Hello everyone, welcome to Dental Mate. Ongoing with the COVID-19 series, today we'll be talking about its signs and symptoms. So let's get started. So, its clinical features include a triad of fever, cough, and dyspnea. But this classic triad is seen only in 15% cases. Other symptoms of COVID-19 disease includes fatigue, headache, nausea, vomiting, joint pain, abdominal pain, and diarrhea. Early symptoms are loss of taste and smell. We must remember that loss of taste and smell is the most commonly seen symptom of COVID-19 disease. Next is the multisystem inflammatory syndrome or MIS. It can be seen in adults known as MIS A or in children known as MIS C, which is the multisystem inflammatory syndrome in children. It is usually milder. It involves skin, kidney, CVS, cardiovascular system, GIT, and other organs. MIS C, that is the multisystem inflammatory syndrome in children, resembles Kawasaki disease or toxic shock syndrome. One of the fatal complications of COVID-19 is hypercoagulability. We know that this is due to the involvement of ACE2 receptors of endothelial cells of the blood vessels. Because of the hypercoagulability, there is increased risk of thrombosis. See, basically what happens is the blood vessels present the ACE2 receptors, because of which the virus gains entry into the endothelial cells. It damages the endothelium, and then the endothelium releases procoagulants that leads to coagulation and thrombosis. So there is increased risk of thrombosis, both venous and arterial, with increased susceptibility in the veins. Next, if we talk about the lab findings, then there is decreased platelet count, increase in prothrombin time, increase in fibrin degradation product, increase in the D-dimer levels, also associated with increased death risk. See, D-dimer is basically a protein which is present in the blood, and after the blood clot is degraded by fibrinolysis, so this is basically what? This is the fibrin degradation product. When there is fibrinolysis, degradation of the blood clot, then D-dimer is formed. The most common complications or thrombotic complications of COVID-19 disease is pulmonary embolism and deep vein thrombosis. Next, if we talk about the clinical spectrum of the disease, then it could be mild, moderate, or severe. The mild form of COVID-19 disease has mild symptoms. The respiratory rate is less than 24 per minute. Partial pressure of oxygen or the oxygen saturation level more than 94% at room air. Moderate form has mild to moderate symptoms, but pneumonia is also seen in this. The respiratory rate is around 24 to 30 per minute, and SpO2 level is between 90 to 94 at room air. Whereas the severe form of the COVID-19 disease would present with severe symptoms and pneumonia, respiratory rate more than 30 per minute, the SpO2 is less than 90% with oxygen. And this can also the patient with severe COVID-19 disease can also represent with septic shock and acute respiratory distress syndrome. Next, the most commonly affected organ in COVID-19 disease are lungs, and the lungs present with diffuse alveolar damage or DAD. DAD, that is diffuse alveolar damage. The diffuse alveolar damage occurs in two phases. The first one is acute or the exudative phase. In this phase, there is hyaline membrane formation, there is endothelitis, alveolar edema, thrombosis. This has a mnemonic like heat, whereas the diffuse alveolar damage has a second phase known as the organizing or the proliferative phase. Okay. In this phase, there is intra-alveolar fibrin formation seen, there is fibroblastic proliferation, type 2 pneumocyte hyperplasia, and squamous metaplasia. So this is it about the clinical signs and symptoms commonly seen in COVID-19 disease. In the next video, we'll be talking about certain lab investigations. We'll be discussing in detail rapid antigen test, RT-PCR test, and the diagnosis of COVID-19 disease. So stay tuned, keep visiting. Thank you.